Hi, everyone. Since you already stretched, I want to be really intentional with my talk. So everyone, please close your eyes and breathe. And think that you're walking in the beautiful streets of London and that you suddenly see that someone is having a heart attack. Can you look at this person? How do they look? Now open your eyes. Those of you who imagined that this was a man, can you please raise your hands? Okay. Those of you that imagined that it was a woman, can you please raise your hands? Okay, there's some, that's good. Those of you that imagined the typical Hollywood heart attack, can you please raise your hands? Interesting. I'm so curious about what the others imagined. So the picture on the right is from the Cleveland Clinic. And it's showing the typical symptoms, one of the symptoms that women could have, such as jaw pain. Because heart disease can happen to anyone at any age, gender, or race. And the reason that there's bias is because we have insufficient data. People don't really understand female cardiac health. We're unaware about the differences of women's symptoms, and there's even adverse treatment outcomes. I was reading a research from the British Heart Foundation and realized that in a long study, there were from 8,000 patients that died, they could have survived if female patients, they could have survived if they had gotten the right treatments. This is actually very scary, and when you look at the UK outcomes today, 50% of women have higher initial misdiagnosis. And then women tend to wait longer when they have symptoms to call 999 following a heart attack. And there's 3.5 million women in the UK that currently live with heart disease. And why do we have this bias in healthcare? There is a lot of latent bias here because it's a societal issue. It was only until 1993 that in the US, women were included in clinical trial. And even today, only 1 in every 4 clinical trial participants are female. There's huge inequality in the outcomes for populations that are different. And for an engineer like me, that throughout my life, I've been the only woman in teams, different teams in the high-tech industry and things like that, like I really wanted to solve this using technology. But when you look at the remote, and when you look at the remote data monitors throughout time, you discover something interesting. I am sure that when you look at today's Apple Watch, it's much more comfortable than this huge TV on his back. But it still has issues. You can only have 1 channel as compared to this Holter monitor from 12 years ago. And it's not continuous like this patch. You actually have to open an app in order to use its famous AI algorithm. But there's even more. These algorithms and the methods that these devices use have been using this very similar methods and techniques for signal processing that are very traditional. And they have what we call AI bias because most of the training sets are from male patients. They have been designed around men. And why is algorithmic bias so important? We can see in different industries how this has impacted a lot when big tech companies like Google, Amazon, and Apple got into trouble because their algorithms failed. Google's AI photo detection a few years ago tagged this couple like gorillas. And even today, face detection still works worse for Black women, which is unprecedented and very obvious when you see a photo as compared to healthcare, right? And then the Amazon AI recruiting tool was basically cataloging women as people that they shouldn't recruit because they were based on training data from men that there's more men in the tech industry right now. So automatically, they had to throw out this tool because it was completely biased. It had learned not to recruit women. And the voice recognition, well, I imagine, I don't know for everyone here, but if you're not a native English speaker, it has a lot of glitches to recognize your accent. And over time, it's a good thing because it can learn from your accent. But when we think about the future, the dream, right? The future of personalized medicine, with genomics and personalized healthcare data of your lifestyle to design individualized treatment that is not one size fits all. We've heard that a lot today. We know that AI in healthcare will only work for populations that are actually represented in the data. So that's why we very intentionally decided to build our company, Bloomer Health Tech, which focuses on AI for women's heart health. And what we do is that we have an everyday monitor. Remember the bulky halters? We basically created an everyday bra that looks and feels like any other bra that you've ever seen, but now it can intimately monitor your heart health over time with fabric sensors. It connects via Bluetooth to an app, and it does analytics that are sex-specific for premenopausal and postmenopausal women. And then, being more specific, we have 100% patient adherence because more women wear bras than wristbands. It has medical grade quality data. We've done early feasibility studies to compare to hospital grade monitors. And we provide Bloomer reports that we're building with doctors to enable AI without bias. And this is my amazing team. Asil and Monica are my co-founders. And we met in the US, and this is the journey that we've all been. Right now we're preparing to launch our clinical trials with the Massachusetts General Hospital's Women's Heart Health Program. And for those of you that, especially the guys that still think why we're not doing this for men too, we're actually very intentionally mixing fashion, health, and AI. Because we think this is just the beginning and that we have a lot to learn from the beauty, the cosmetic, and the apparel industries, which for a long time have understood that on the outside, we're all quite different in our complexity, our size, our tones. We're very different. There's products very personalized to each one of us. And healthcare has to go that way too. That's why we're making healthcare as personal as your bra. Thank you.